Hello, my name is Wesley Olson. This is for the changing dressing using sterile technique. I'm going to walk in to my patient's room. I'm going to introduce myself. I'm going to confirm the name and the date of birth on the wristband. Hi, my name is Wesley. I'm going to be changing your dressings today. Can you please tell me your name and your date of birth? I'm going to confirm that it matches. It does, so we're good. First, I'm going to walk my patient through what we're about to do. So I'm going to just let them know, like, hi, I'm going to be changing your dressings today. Just gonna make sure that they know, like, hey, please do not, during this process, please do not touch any of the materials that I will be using, just so that we can ensure sterileness of the dressings, just to protect your wound and keep it as clean as possible. Perfect. First, I'm gonna perform hand hygiene. Awesome. Then I'm going to grab a clean pair of gloves. Great. Some gloves. Awesome. Perfect. All right, so now that I have a pair of clean gloves on, we're going to take off the existing bandage. So how we want to do this is we want to make sure that we are trying our best to pull with the hair if they do have longer hair. And then I'm also going to start, you want to make sure you're pulling parallel with the wound. So we're going to start off at the edge. I'm putting my finger next to each time I pull, just to make sure it's not tugging on the patient. And while I'm doing this, I'm going to ask if they're doing okay, ask them if they're comfortable. And then if they're not, I'll take it slower. Awesome. Okay. I keep pulling it just like this. Should be okay. Perfect. And I'm gonna discard this in my bio bag right here. Awesome. And then while we're doing this, I'm gonna inspect it. I'm gonna notice any color change, any edema, anything like that. So I'm gonna poke around, just feel for tenderness. Everything does look good. Great. I don't see any odors. I don't see any, discoloration. So everything does look good. I'm gonna discard my gloves. Discard it in my bio bag. I'm gonna do hand hygiene once again. All right, and then I'm gonna start putting on my sterile gloves. My sterile glove bag was already opened because this is my re-recording. However, in the real world, it will be fully folded up. And just a disclaimer, I'm gonna move this just a little to the side. Awesome. Okay, so now that we have everything in place, I'm going to grab my sterile glove kit. I'm gonna open it up, making sure to only touch the 1-inch border on the outside. All right, I'm gonna grab this glove, my non-dominant hand, put in this glove first. The gloves in this kit are really tiny. There we go. All right, next I'm gonna put on this glove. I'm gonna go on the inside of it. And stick it in my hand. This one as well. Now that I have 2 sterile gloves on, I'm going to just readjust my pinky. Again, these gloves are really small in this kit. In the real world, I would make sure that I have the right size for myself. Just so everything look good. And also this one as well. Awesome. So, as I just put these gloves on for the first time, I'm going to interlock my fingers, make sure everything's good. All right, and then again, in the real world, we also would have everything separated, but I do only have a small little table, so I'm going to move this to the side just so you can see a little bit better. However, in the real world, I would not have touched that. I would have just left it as is and separate from the wound, so to keep sterileness. All right, and then I'm gonna open up my sterile kit. I'm gonna grab my cleanser wipe, and I'm gonna start on the inside of the wound right here. Awesome, just like this. And then I'll also grab a brand new one. However, this kit only does come with one, so I'm gonna discard this. I'm gonna grab a brand new one. I'm gonna start on the outside of the kit. Sorry, the outside of the wound. Awesome, just like that. So now this, this would be my second one, so I'm gonna discard this as well. Awesome, I'm gonna go back into my kit. I'm gonna grab out my cloth for drying. Again, this kit only comes with one, so I'm gonna drop it into my clean glove. I'm gonna just pat the inside of the wound. Awesome, I'm gonna discard this. Again, only one, so I'm gonna grab another one. Grab my second one. Clean the outside of the wound. All right, now that it's all dry, I'm gonna discard this as well. Then I'm gonna just let the patient know that I will be putting on a new bandage. I'm gonna grab the bandage. It is already used because this is my second time filming. So in this, I'm going to take this off. Awesome. Great, and I'm gonna stick this onto the clean wound. Make sure I'm starting in the middle. And then working my way out. Awesome. Great. Then I'm going to initial, I'm going to date, and then I'm going to put the time that I did this as well. And then, yeah, everything's good. I'm going to make sure the patient's comfortable again, ask if they need anything, let them know that they did a great job, and then I'm going to take off my gloves. First, I'm going to take off this glove. Oh, I'm sorry. I'm going to clean up my area with my gloves on. So I'm just cleaning stuff up. Dispose this into the bio bag. Dispose of this in the bio bag as well. Great, then I'm gonna take off my gloves. Here, going underneath. Great. And perform hand hygiene. And as I walk out, I'm going to close the door behind me, make sure that curtain stays closed as well for patient privacy, and then I'm gonna document all of my findings as well. Awesome, thank you.